Okay, so ready to talk about the future of healthcare. The article you sent over really dives into how technology is changing, like everything. It seems like healthcare is on the verge of a total transformation.
Yeah, it's a really exciting time to be following this. One of the biggest things we're seeing is this move towards patient empowerment.
Oh, yeah, certainly.
Instead of patients passively receiving treatment, tech is giving people the tools to, take charge of their own health.
Right. And this article backs that up with some pretty wild numbers. Like, get this, the global smartwatch market could be worth over $100 billion by 2027. I mean, that's insane. I have to admit, even I was pretty surprised by that one.
What's really interesting, though, is how these devices have evolved way beyond those simple fitness trackers. Like, we're talking about sophisticated health monitoring capabilities right there on your wrist. The Apple Watch, for instance. It can track everything from your heart rate and sleep to blood oxygen levels. It even has, ECG monitoring and fall detection.
Yeah, it's wild, right? It's
Right.
like having a mini doctor with you 24/7.
Totally.
But it makes you think, with all this data, how is the doctor-patient relationship changing?
That's a really good question. I think we're definitely seeing a push towards a more collaborative approach to healthcare. Patients come in more informed, they're more engaged in their own care, and that leads to much more productive conversations.
Yeah, it's like we're moving away from that old doctor knows best thing, which is actually really empowering when you think about it.
Absolutely.
Yeah.
And this shift towards patient empowerment is also happening at the same time as this huge surge in telehealth, which the article talks about too.
Yeah.
Remember those early days of the pandemic when everything went virtual?
Oh, yeah.
Well, that had a massive impact on how people access healthcare. And honestly, I think those changes are here to stay.
Yeah, for sure. The article mentioned this mind-blowing statistic, a 63-fold increase in telehealth use for Medicare users from 2019 to 2020.
Wow.
I even have a few close friends who actually prefer virtual appointments now. Have you tried it?
I have. I can definitely see
Yeah.
the appeal, especially for routine checkups or managing chronic conditions. It just removes so many barriers like travel time and having to take time off work. And this isn't just a U.S. thing either. The article specifically mentioned Thailand as a country really embracing telemedicine, especially for reaching those more rural communities.
That's amazing. It's incredible how technology can bridge those geographical gaps, right?
Yeah.
Speaking of global trends, the article also mentions declining birth rates and aging populations impacting healthcare systems around the world. By 2050, the number of people aged 60 and over is expected to more than double,
Wow.
reaching a massive 2.1 billion.
That's a lot of people.
It is. It's a pretty huge shift. It makes you think about how we approach healthcare. It's no longer just about treating diseases. It's about extending lifespan and, more importantly, health span. The number of years we live in good health.
Right.
Which makes a lot of sense. Who wants to live longer if they're not healthy and able to actually,
Yeah.
enjoy it? Right. But how do you even extend health span? Is that even possible?
That's the million-dollar question. Researchers are exploring so many exciting avenues, but one area that's getting a lot of attention is AI, particularly in diagnostics and treatment.
AI doctors. Okay, that sounds kind of like something out of a sci-fi movie, honestly.
It might sound futuristic, but it's closer than you think. We're already seeing AI algorithms that can diagnose certain diseases just as accurately as human doctors.
Wow.
And even better in some cases. For example, there was a study published in the Lancet Digital Health that found AI could diagnose diseases in 87% of cases.
87%. Wow, that's really impressive. So how does it work? Is it like having a robot doctor analyze your symptoms?
Not quite a robot doctor just yet, but it is all about data analysis.
Okay.
These AI systems are trained on these massive data sets of medical images, patient records, research findings, things like that. And all of this data lets them identify patterns and make predictions about a patient's health with incredible accuracy.
That's amazing. But are we talking about replacing doctors with machines?
I don't think it's about replacing, but more like augmenting their expertise,
Okay.
Imagine a world where doctors have AI assistants that help them analyze complex medical data, identify potential risks early on, and really personalize treatment plans. I think that's the real potential here.
So it's like giving doctors a superpower, basically.
Exactly. And it's not just about diagnostics either. AI is also speeding up the development of new treatments. The article mentioned a company, Benevolent AI, that used their platform to identify an existing drug, baricitinib, as a potential treatment for COVID-19.
Hmm.
And they did all of that in a matter of weeks. That's unheard of in traditional drug development.
Weeks instead of years. That's incredible. It's a game changer. Okay, so AI is changing the game for diagnosis, treatment, drug discovery.
Yeah.
What else is coming up in this healthcare revolution?
Well, we've talked about living longer and healthier lives, but what about more personalized healthcare?
Okay.
That's where personalized medicine comes in. It's tailoring treatments to your unique genetic makeup.
Personalized medicine. That sounds incredibly expensive, honestly. Like something out of a science fiction movie.
It used to be. Sequencing a human genome back in 2001 cost $100 million.
You're kidding.
Today, less than 1,000.
Wait, seriously? That's like a 99.999% price drop. No wonder this personalized medicine thing is, taking off.
Exactly. And as the cost of genomic sequencing keeps dropping, personalized medicine is probably going to become more and more common.
Wow.
Imagine treatments tailored to your specific genes and how your body responds to certain medications.
It's like the ultimate form of preventative care, right? You can understand your risk factors and head off diseases before they even develop.
Exactly. And it all comes back around to the concept of health span. It's not about tacking years onto our lives, but adding life to our years.
Right.
And it seems like technology is a big part of making that happen.
Yeah, for sure. It's definitely a lot to process. So far, we've covered AI doctors, personalized medicine. Technology is transforming the healthcare landscape at an insane pace.
Yeah.
But what does all of this mean for a country like Thailand? The article mentioned it as a major player in this global shift.
Thailand's interesting because they're going all in on digital health. They've even launched a national policy called Thailand 4.0 to become a hub for medical technology and innovation.
Thailand 4.0, I like it. What does it actually look like in practice, though?
Well, they're putting a lot of resources into telemedicine, especially in rural areas.
Okay.
There are platforms like Chewy and See Doctor Now that offer online consultations and even let patients order medications online.
That's amazing. So someone in a remote village could, consult with a specialist in Bangkok without ever leaving home.
Exactly. And it's not just about convenience. It's about providing quality healthcare for everyone, regardless of where they live.
That's amazing.
What?
This all sounds almost too good to be true, though. There have to be some downsides to all this digitalization and data sharing, right?
You're right. Every tech advancement comes with its own challenges. Healthcare is no different. One of the biggest concerns, and the article mentions this, is data privacy. With all the sensitive health information being digitized, how do we make sure it stays protected?
Yeah, that's a good point. The last thing you want is your medical records ending up in the wrong hands.
Exactly. That's why we need strong data protection regulations, especially in this new era of digital health.
So what does that look like? Are there any countries doing a good job balancing innovation with data privacy?
The article mentions Europe's GDPR and Thailand's PDPA. Both of these are frameworks designed to protect patient information.
Okay, so there are frameworks in place. But how well do they actually work? And what if something goes wrong?
Those are the big questions. And it's not just about having regulations on the books. It's about enforcement, transparency, and accountability.
It's probably going to be a learning curve as we all adjust to this new reality too, right?
Absolutely. It's constantly evolving. It really requires a constant dialogue between policymakers, healthcare providers, tech companies, and of course, the public. We all have a role to play in shaping the future of healthcare.
For sure. Okay, so far we've talked about AI, personalized medicine, and the challenges of data privacy. But there's another really important aspect of this whole thing. We need to address the business side of things. How is all of this impacting the healthcare industry, especially in places like Thailand that are really leaning into these advancements?
It's really interesting. On the one hand, you have these traditional healthcare providers who now have to adapt to this new world of tech-savvy patients.
Right.
These patients have more information, higher expectations, and they're not afraid to shop around for providers that meet their needs.
Healthcare is becoming like a consumer-driven market, almost like choosing a smartphone or booking a flight online.
It kind of is. Patients are becoming consumers, and they're looking for a more personalized and convenient experience.
Right.
And then on the other side, you have these giant tech companies like Google, Apple, Amazon, who are all entering the healthcare scene. They're bringing their huge data analytics power and user-friendly design skills to the table.
So it sounds like a bit of a showdown brewing between traditional healthcare providers and these tech giants.
It's more of a convergence, really. Both sides have their own strengths. I think the real winners will be the ones who learn how to work together effectively. The article mentioned how some hospitals in Thailand are already doing this.
Oh, yeah. Like who?
Bangkok Dusit Medical Services and Bumrungrad International Hospital, for example.
Okay.
They're attracting patients from all over with their high-end services and cutting-edge treatments.
That's like healthcare tourism is becoming a thing.
Right.
People traveling to other countries for the best, most high-tech treatments.
It's a growing trend, for sure, and it shows how global this whole healthcare revolution is becoming. But it also raises important questions about, fairness and access. What about the people who can't afford to fly across the world for those cutting-edge treatments?
That's a really good point. It's great to talk about these amazing advancements,
Yeah.
but they don't mean much if they're not available to everyone.
Exactly. And that's something we have to keep in mind. We need to make sure these advancements benefit everyone, not just a select few.
That's a really important point, and one we could talk more about. But for now, let's pause here. We've covered a lot in this first part of our deep dive, but trust me, there's a lot more to explore. We left off talking about access and equity in this new world of healthcare. Makes you wonder, as these technologies get even more advanced, will it help close that healthcare gap? Or will it make it even wider? What do you think?
It really is the big question, isn't it? And it's something we have to be really careful about. This article actually brings up how these advancements could actually make those inequalities even worse. I think that's a really important conversation to have.
Well, for sure. I mean, it's great that we're talking about people flying to Thailand for these cutting-edge treatments, but what about the people who can't even get basic healthcare in their own countries? It's kind of like a double-edged sword.
It is. It just shows how important it is to have, a strong safety net and policies that guarantee everyone can get healthcare no matter where they live or how much money they make.
Yeah, because technology alone can't solve these bigger problems. It's more about how we actually use it and who gets to benefit from it, right? But on a slightly different note, the article also talks about using technology to, help us live longer. The whole life extension thing. It's kind of sci-fi, but really fascinating.
Right. It's definitely one of the more interesting areas, both from a scientific and ethical perspective. We're talking about potentially slowing down aging, maybe even reversing it.
Okay, but before we go down that rabbit hole, I have to ask, from a purely scientific point of view, is extending lifespan even possible? Or is that still just, a fantasy?
It's an active area of research, for sure. And while we haven't found the fountain of youth yet, there are some promising leads. The article talked about something called senolytics.
Senolytics?
Yeah, they're drugs that target and remove these things called senescent cells.
Senescent cells?
Yeah.
That sounds kind of intense. Honestly, I've never even heard of those.
Most people haven't, but they're a big part of aging. Basically, as we get older, these cells build up in our bodies and they stop dividing and start releasing these harmful things that cause damage and inflammation in the tissues around them.
So they're like the bad neighbors in our bodies, always causing trouble and making a mess for everyone else.
Exactly. And the thinking is that if we can get rid of those senescent cells, we might be able to slow down the aging process, potentially even prevent or delay age-related diseases.
Okay, that makes sense. But I mean, messing with the fundamental parts of life like that, there have to be some ethical concerns, right?
Absolutely. And this is where the social part of all of this really comes in, because it's not just about what's possible with science, it's about what's right and how these advancements would impact society as a whole.
It's like opening a Pandora's box, right?
Yeah.
If we could actually double our lifespans, what would that do to society? The economy? The planet? Those are some huge questions.
They are. And there are no easy answers. Imagine what that would mean for retirement, Social Security, even just the idea of generations changing. If people are living longer, healthier lives, that changes everything.
It's mind-blowing when you really think about it. And like we talked about earlier, what about the potential for things to become even more unequal? Would these life-extending treatments only be available to people with money, creating a whole new divide between the haves and the have-nots?
That's a huge concern, absolutely. And it's not just about who gets the treatment, it's about who has the information and resources to even make those decisions about their health. We have to make sure everyone benefits from these advancements, not just a select few.
Right, because the last thing we want is a future where only rich people get to live longer while everyone else is just left behind.
Exactly. These are really complex issues, and they need a lot of thought and open, honest conversation. And it's not just up to scientists and politicians to figure out. We need to be discussing this as a society.
Totally agree. And it's not just these big futuristic things like life extension, right?
Yeah.
Even the things we're seeing now, like telehealth and personalized medicine, those come with their own ethical and social dilemmas.
You're right. And I think this article actually does a pretty good job of showing that. It's not just saying tech and healthcare is amazing, everyone go for it. It acknowledges that it's complicated, that there are downsides, and that we need to be careful as we move forward.
Which I appreciate, because it's easy to get swept up in the excitement of all of it. New gadgets, life hacking apps, personalized treatments. It's like we're being sold this future of perfect health. But realistically, it's just not that simple.
It's way more complicated. And it's important to remember that ultimately technology is just a tool. It can be used for good or for bad. It's our responsibility to make sure that it's being used ethically and responsibly with the focus on better health for everyone, not just a select few.
Okay, so let's say we're all on the same page about embracing technology, but also being aware of the potential downsides. What can people actually do, like in their own lives, to navigate this new healthcare world more effectively?
Great question. I think it starts with education, just like we're doing here, honestly. The more we know about these advancements, the better we can decide what's right for our own health and advocate for policies that work for everyone.
Right, because knowledge is power, especially when it comes to something as personal and honestly kind of confusing as healthcare. But aside from just staying informed, what else can people do?
Don't be afraid to be proactive. Ask your doctor about new treatments. Research different healthcare providers. Explore all your options.
So it's like that whole take charge of your health thing, but even more so now because of technology.
Exactly. You have more information and resources available to you than ever before. Use them. And never underestimate the power of lifestyle choices either. Diet, exercise, sleep, stress management, those will always be the foundation of our well-being, no matter how advanced technology gets.
It's like they say, you can't outsmart a bad diet. All the fancy tech in the world won't make up for unhealthy habits.
Exactly. Technology can make us healthier, but it can't do all the work for us. We still have to make healthy choices every day.
It's about finding that balance,
Yeah.
right? Using the power of technology, but also remembering those core things that keep us healthy.
Yeah, absolutely. And speaking of balance, I think it's really important to find that balance between using these new technologies and protecting our privacy too. We've talked about how important data security is, but we also need to be careful about what information we share online and through health apps.
Yeah, you're right. It's so easy to get caught up in tracking every step we take and everything we eat, but we have to remember that this information is valuable and it needs to be protected.
Exactly. Be careful about the apps you use, read the fine print, and don't be afraid to ask your doctor about how they handle data security. You have a right to know what's happening with your personal health information.
It's like that old saying, an ounce of prevention is worth a pound of cure. But in this case, it's about preventing those data breaches and protecting our privacy. Okay, so we've talked about what individuals can do. What about the bigger picture? What needs to happen at a policy level to make sure everyone benefits from this healthcare revolution?
That's where things get really interesting. And honestly, this is where I wish the article went a bit deeper. It mentions a few key policy areas, but there's definitely room for a more detailed discussion here.
Okay, well, let's dive in then. From your perspective, what are the biggest policy things we need to be thinking about when it comes to navigating this new world of healthcare?
Well, for one thing, we need to make sure these new technologies are accessible to everyone. And I don't just mean being able to afford them. We need to think about things like digital literacy, making sure people know how to use these technologies. And the infrastructure needs to be there too, especially in places without reliable internet access.
That's a really good point. Having the latest gadgets and treatments doesn't mean much if people can't even use them or if they live in areas without good internet.
Exactly. And in some cultures, there might be resistance to these new technologies or a preference for more traditional healing practices. So it's about finding ways to integrate these advancements in a way that respects different values and beliefs.
It's about meeting people where they are, right? Not just assuming that one size fits all. What other policy areas should we be thinking about as we move into this new territory?
Workforce development is a big one. As these technologies get more advanced, we need people who know how to use them. That means investing in training and education for healthcare professionals. But we also need to think about how to get new people excited about working in healthcare.
So we need more doctors and nurses who are also good with technology. That makes sense.
Right.
But it also seems like we'll need data scientists, software engineers, even ethicists. It's like the future healthcare workforce will be totally different from what we're used to.
Exactly. And it's not just about technical skills. It's about being able to think critically, adapt to new situations, and navigate ethical dilemmas. Those are the skills that will be essential in a healthcare system that never stops changing.
It's almost like we need to rethink what it means to work in healthcare entirely. Okay, so we've got access, we've got education. What else?
We can't talk about the future of healthcare without talking about regulation. As these technologies become even more powerful, we need to make sure they're being used safely, ethically, and responsibly.
That's a lot of responsibility for governments and regulatory bodies. Are there any countries that are doing a good job of this right now?
It's still early, but some countries are taking the lead. The European Union, for example, has been pretty proactive in developing regulations for AI and data privacy.
That makes sense. They have GDPR, which is supposed to be the best standard for data protection, right?
Exactly. And they're using that foundation to make specific guidelines for using AI in healthcare, which is super important.
Okay, so there are definitely models out there we can learn from. But it sounds like this is going to be an ongoing challenge, right? Keeping up with these rapid advancements and making sure the regulations are still doing their job.
It's a constant balancing act, for sure. But I think if we can have these conversations, raise awareness, and work together, we can create a future of healthcare that's both innovative and fair.
I like that. Innovative and fair. Those should be the guiding principles as we navigate this new landscape.
Yeah.
But it's one thing to talk about these big shifts and another to bring it back down to earth for our listeners. So let's say someone's listening to this and thinking, okay, this is all interesting, but what does it actually mean for me and my health? What advice would you give them? So you were talking about, the policy side of things. It seems like making sure everyone has access to these incredible new technologies is going to be a huge challenge.
Yeah, absolutely. And it's not just about cost either. We have to think about things like digital literacy, like making sure people actually know how to use this technology. And the infrastructure needs to be there too, especially in places without, reliable internet.
Right, because having the latest gadgets and treatments doesn't help if you don't even know how to use them, or if you're living somewhere without decent internet.
Exactly. And then there are also cultural differences to consider. In some cultures, there might be some resistance to these new technologies. Maybe people prefer more traditional types of medicine,
Yeah.
So it's about figuring out how to make these new things work while still respecting those values and beliefs.
It's about meeting people where they are,
Yeah.
right? Not just assuming that everyone's the same. What else should be a top policy priority as we navigate all of this?
Workforce development, that's a big one. As these technologies get more advanced, we're going to need people who know how to use them.
Right. And that means investing in, like, training and education for our healthcare workers. But it also means finding ways to get people excited about working in healthcare in the first place.
So more doctors and nurses who are also good with technology. That makes sense. But it also seems like we're going to need, data scientists, software engineers, even ethicists. Like, the whole idea of what a healthcare worker is might be totally different in the future.
Exactly. And it's not just about the technical stuff either. It's also about critical thinking skills, being adaptable, knowing how to handle all these ethical questions that come up. Those are going to be crucial skills in a healthcare system that's always changing.
It's almost like we need to rethink what it means to work in healthcare completely. Okay, so we've got access, we've got education, what else? Well, you can't really talk about the future of healthcare without talking about regulation. As these technologies become more and more powerful, we really need to make sure they're being used safely, ethically, and responsibly.
That's a lot to put on the shoulders of governments and regulatory agencies. Are there any countries that are doing a good job of this right now?
It's still pretty early, but some countries are stepping up. The European Union, for example, has been really proactive about developing regulations for things like AI and data privacy.
That makes sense.
Okay.
They've got the GDPR, right?
Yeah.
That's supposed to be the best standard for data protection.
Exactly. And they're using that as a foundation to make more specific guidelines for AI in healthcare, which is really important.
Okay, so there are definitely some good examples out there. But it sounds like this is going to be a constant challenge, right? Trying to keep up with how fast everything's changing and making sure the regulations are still doing what they're supposed to do.
It's a balancing act, that's for sure.
Yeah.
But I'm hopeful that if we keep having these conversations, if we keep raising awareness, and if we all work together, we can build a future of healthcare that's both innovative and equitable.
I like that. Innovative and equitable. Those should be our guiding principles for sure. But, It's one thing to talk about these huge changes. It's another to think about what it actually means for, the average person. So let's say someone's listening to this and they're thinking, okay, this is all super interesting, but what does it mean for me and my health? What advice would you give them?
That's the million-dollar question. And it's something I think about a lot. I'd say the most important thing is to really own this idea of being an active participant in your own health.
So not just waiting until something goes wrong, but actually being proactive about staying healthy.
Yes, exactly. And that starts with, just like you guys are doing right now, staying informed. Don't be afraid to ask your doctor questions. Do your own research on different treatment options. Really advocate for yourself and what you need.
It's like being the CEO of your own health, right? You get to make those informed decisions. You don't just accept whatever your doctor tells you without question.
Yes, exactly. And don't forget, technology can be a really powerful tool for this. Use those health apps, check out telehealth options, and definitely tap into those online resources and support groups.
There's something to be said for connecting with other people who are dealing with the same health issues, or even people who are just excited about the future of healthcare like we are.
Absolutely. And as we're embracing all of these new possibilities, it's also really important to remember the basics. No matter how fancy technology gets, things like diet, exercise, sleep, stress management, those are always going to be essential for well-being.
It's like that saying, you can't outsmart a bad diet. You can have all the latest technology, but it can't replace those healthy habits.
Exactly. Technology can help us improve our health. It's not a magic bullet. We still have to put in the work.
It's all about finding that balance, right? Being excited about the future of healthcare without forgetting about those fundamental things that keep us healthy. Well, wow, we've covered a lot in this deep dive. AI doctors, personalized medicine. We even talked about the ethics of living longer and the importance of making sure everyone benefits from these advancements. It's definitely clear that healthcare is in the middle of this huge transformation.
It really is an amazing time to be alive. And if there's one thing I want everyone to take away from this, it's that we're not just watching this happen. We all have the power to shape the future of healthcare, both through the choices we make every day and by working together as a society.
That's a really inspiring message. So as we wrap things up here, what's the one big takeaway you'd like to leave our listeners with today?
Stay curious, stay informed, and get involved. The future of healthcare isn't something that just happens to us. We all create it together.
I love that. Beautifully said. And on that inspiring note, we'll wrap up this deep dive into the social transformation of medicine. A huge thank you to you for guiding us through this fascinating and honestly sometimes overwhelming topic.
It was my pleasure. Thanks for having me.
And to you, our listener, thank you for joining us on this journey. We'll see you next time for another deep dive into a topic that matters.